In this video, we'll explore the anatomy of the iliac arteries, which are major branches of the abdominal aorta. These vessels are essential for delivering blood to the pelvis, the pelvic organs, and the lower limbs. We'll look at the course, branches, and key differences between the internal and external iliac arteries, and highlight their clinical significance in both diagnostic imaging and surgical procedures. To do so, we will start with a brief introduction, followed by detailing the descriptive anatomy of the common iliac arteries, the external iliac artery, and the internal iliac artery, and finally a conclusion to summarize all the key points. There are two common iliac arteries. Each one divides into two main branches, the external iliac artery and the internal iliac artery. Together, they supply blood to the pelvis and the lower limb. Let's start with the common iliac arteries. Primarily considered as transit arteries, they arise from the aortic bifurcation. They are short and voluminous. They end by dividing into the internal and external iliac arteries near the sacroiliac joint. The relationships of the right common iliac artery are as follows. Anteriorly, the lumbar sympathetic trunk, the left common iliac vein, and the psoas major muscle. Laterally, the gonadal vessels and the ureter. The relationships of the left common iliac artery are as follows. Anteriorly, the inferior mesenteric artery. Posteriorly, the left common iliac vein and the psoas major muscle. Laterally, the gonadal vessels and the ureter. Moving on to the external iliac artery. It serves as a transit artery to the lower limb and part of the abdominal wall. Two main collateral branches arise from it: the deep circumflex iliac artery and the inferior epigastric artery. Let's tackle now the internal iliac artery. It often originates at the level of the lumbosacral disc. It arises from the posteromedial division of the common iliac arteries and serves as the main artery of the pelvis, supplying both the pelvic wall and its contents. The internal iliac artery descends vertically along the pelvic wall, accompanied by the interiliac and internal iliac lymph nodes. It is related to, posteriorly, the sacrum and the sacroiliac joint, laterally, the psoas muscle and the external iliac vein, medially, the terminal part of the ilium on the right side, and anteriorly, the ureter. The terminal branches of the internal iliac artery divide at the level of the greater sciatic notch into two trunks: an anterior trunk and a posterior trunk. The anterior trunk consists of the obturator artery. It is a branch of the anterior trunk of the internal iliac artery. It descends forward towards the obturator canal, where it is applied to the obturator muscle, with the obturator nerve running above it and the obturator vein running below it. It gives muscular branches to the psoas, a vesical branch, and a retropubic branch. The terminal branches of the obturator artery descend forward towards the obturator canal, dividing into two branches: an anterior branch and a posterior branch. The umbilical artery is a branch of the anterior trunk of the internal iliac artery. It is the first visceral branch of the internal iliac artery, descending to run along the lateral surface of the bladder. It gives off 2 to 5 vesical arteries. The internal pudendal artery arises from the internal iliac artery and is responsible for supplying blood to the perineum, external genitalia, and certain muscles of the pelvic floor. The internal pudendal artery passes through the pelvis, descending vertically. It then traverses the infrapiriform foramen and exits the pelvis between the sciatic nerve and the pudendal nerve. It is accompanied medially by the pudendal nerve and the inferior gluteal vessels, and laterally by the sciatic nerve. It then passes behind the transverse ligament and terminates in the deep artery of the penis or clitoris, and the dorsal artery of the penis or clitoris. Its collateral branches are the urethral artery, the inferior rectal artery, and the perineal artery. The posterior trunk of the internal iliac artery gives rise to the iliolumbar artery and the superior gluteal artery. To conclude, the iliac arteries are key conduits for blood flow to the pelvis and lower limbs. Their branching patterns and anatomical variations must be well understood to prevent complications during surgical procedures or interventional radiology. Given their central role in lower limb perfusion and pelvic organ vascularization, the iliac arteries remain a critical focus in both anatomical education and clinical practice.